Good afternoon, everyone. Over the past 3 months, life across the Northwest Territories has changed quite dramatically. We've all had to change the way we live and work. We have also had to change the way we interact with each other and how we interact with other jurisdictions. One thing that has remained true throughout the COVID-19 pandemic is the Government of the Northwest Territories' commitment to work and make decisions with the best interests of Northwest Territories residents at heart. In keeping with that commitment, it has been our main priority since the start of this pandemic to protect the health of the people of the Northwest Territories. The Office of the Chief Public Health Officer, with support from government Northwest Territories departments, moved quickly to put strong measures in place to keep COVID-19 from spreading throughout the N.W.T. and find ways to tell communities and residents about the new measures. But we did not do this alone. I want to take a moment to thank the media, community and Indigenous governments, as well as MLAs for helping to spread the message. I also want to thank everyone who obeyed the CPHO's orders and the many businesses, NGOs, and agencies who supported our efforts. Each of us working together brought us to where we are today. Our actions resulted in the Northwest Territories not having a diagnosed case of COVID-19 in almost 10 weeks. It is these strong, early measures that allowed us to reach phase 2 of our Emerging Wisely plan for relaxing the public health restrictions. This is a phase I know many residents and businesses are excited to be entering. By working together, we are where we are today, but we still have work to do. This pandemic is not over, and we have heard that there will likely be a second wave coming. Each of us will still need to follow the orders issued by the Office of the Chief Public Health Officer if we are to protect ourselves, our neighbors, and our communities. Today we enter phase 2, and shortly Dr. Kandola will outline that phase for each of us in greater detail. She will also outline the changes being made with regards to travel in and within our territory. I know that this week there's been a lot of dialogue in the media and in the House about travel restrictions as it pertains to the public health orders. And we recognize that we need to be clearer on the authority and operation of our travel restrictions. The fact is, our government cannot stop Canadian residents from entering our territory, but we can make orders limiting how people can move inside the territory so we can protect residents and communities. The amendments to the travel restrictions made today are intended to provide greater clarity for those traveling within the Northwest Territories and for our officials who are protecting public health by monitoring travel. Again, I can't thank everyone enough. By following the orders, supporting our economy by shopping local, or helping to spread knowledge to one another, you're all contributing to our efforts in your own way. It is truly appreciated, and I thank all of you. On that, I'm going to pass it over to Minister Thom to say a few words. Thank you.
Thank you, Premier. Today we turn the page and begin a new chapter of our pandemic response. I think what residents are looking for is some assurance on the strength of our public health response. This response is built to break the chain of infection, to keep our communities safe, and to protect our healthcare system. Since March 21st, that meant close to 6,000 self-isolation plans filled out by those entering the territory. Each of these plans work to keep communities safe. The second is aggressive testing. With nearly 5% of our population tested, we have consistently kept our rate among the highest in Canada. And that means we have a better idea than just about anywhere of whether this virus is moving in our communities. And today we are strengthening and clarifying our third pillar, restricting travel within the territory. All of our previous exemptions to our travel restrictions within Northwest Territories are in place for traditional harvesters, essential workers, and those supporting them, supply chain workers, infrastructure workers, and remote camp workers. The same social distancing and self-isolation protocols remain in place for these groups. Now, those looking to move to the Northwest Territories, come for work, attend post-secondary, will also be allowed to travel within the Northwest Territories. We have also clarified the ability to seek exemption under our exceptional circumstances to reunite with families. I want to be clear, every one of these people will require to self-isolate. Fill out a self-isolation plan and stay isolated for 14 days. There is one new exemption to the self-isolation to announce. As of today, N.W.T can travel to our territory without self-isolating. As I understand, Nunavut is working towards the same. Those who do not fit any of these circumstances, like those coming to sightsee or just visit with a friend, will not be allowed to travel within the Northwest Territories without getting a ticket. The ticket for failing to comply with our travel restrictions is $1,500, with a victim surcharge of $225. These are strong distinctions to staying. The message is clear. If your travel is not essential, don't come. And if you do, it could get very expensive. It is these pillars allowing us to move into phase 2 of the Emerging Wisely and revitalize our communities. In phase 2, our communities will begin to feel a little closer to normal. And our spectacular parks are now open for business with new rules for Northwest Territories and Nunavut residents. Many businesses will work to open their doors. People will be able to hit the gym again with new rules. Restaurants will begin offering sit-down service, and these are just the highlights. Dr. Kandola will go into much more detail. I want residents to understand that as we open, our responsibility to each other only grows, because our risk grows with each restriction we relax, and it only takes one infection to quickly become dozens. So we still need to be careful every single day, and we need to do it, not for ourselves, but for those we love and for those who we care about. Keep 2 meters apart as much as possible. Wash your hands. Get used to wearing a face mask when you're out. Stay home when you're sick, and if you self-isolate when required. I commit to redoubling our commitment to transparency, to getting residents good information and ensuring strong leadership throughout this pandemic. We have achieved so much already. We moved quickly, if not perfectly, to get there. Our cabinet, our Chief Public Health Officer, and our public service will work tirelessly to strengthen our response and keep you safe as we rise to this challenge together. Now I would like to invite Dr. Kandola to dive into this new chapter and give you some more details. Thank you.
Thank you, Minister. Thank you, Premier. I want to begin by saying it has been 8 weeks since our last case of COVID-19 in the N.W.T had fully recovered. And it has been 4 weeks since we implemented phase 1 of our Emerging Wisely plan. We've completed 2,364 tests as of this morning, with 42 tests pending. I want to thank everyone for their hard work and for following the guidance and direction we have been providing to the public so far. Today, we are announcing 2 changes to our current public health orders. I will start with our changes to the travel restriction and self-isolation protocol. As the Minister mentioned, we added exemptions to our restrictions on travel within the Northwest Territories. I believe everyone understands who is allowed to travel within our territory, but I know people want to learn about the process, what happens when someone shows up at a checkpoint or at the airport and they don't meet any of the exemptions. So let me walk you through the process. Someone shows up at a checkpoint by car. They do not have a self-isolation plan, and they do not meet any of the exemptions, and they have not sought an exemption under exceptional circumstances. They would be informed that proceeding any further into the territory would contravene our public health orders, and they will be given the chance to turn around voluntarily. If they do not, they will be ticketed. This particular ticket could cost $1,500 with a $225 victim surcharge. And the person could receive tickets daily. That means they would be charged this fine for each day they remain in the territory contravening the order. If that person showed up at an airport, they would be informed that proceeding further would be an offense, and they would be given the opportunity to voluntarily turn around. They would be required to stay in the airport and not proceed to our communities. If they proceeded, they would get a ticket. Recognizing that there are not always immediate flights, the Office of the Chief Public Health Officer will offer an exemption for the person to isolate until they can leave the territory. If the person does not take their earliest flight, they could be ticketed. And if they stayed, they would be ticketed every day, with additional enforcement possible under the Public Health Act. These actions will help protect the residents of the Northwest Territories by limiting travel within our territory and discouraging travel in general as we continue to respond to this pandemic. If, however, that person comes to the N.W.T and has filled their self-isolation plan and is a resident of the Northwest Territories or Nunavut or falls under exemption category, their experience will be much different. Depending on the type of entry, a public health officer will review their paperwork and ensure they have the documentation in place. They would provide contact information for the self-isolation center or a person who they can direct their questions to while they're self-isolating. If the person needs help, they will provide directions to the right person that can assist. And yes, you heard me correctly. We now have a bubble with Nunavut as of today, where N.W.T can travel to the N.W.T without self-isolating if they're coming from the N.W.T communities. Now, on to the other order, our Emerging Wisely Phase 2. I want to say again how proud I am of our residents working together to keep each other safe. We're all here because of you. So what does Phase 2 mean for the Northwest Territories? It means people and communities can do more things together. Up to 25 people can be indoors at your office, business, or organization, but people still must keep 2 meters apart. And you may need to put some time in getting your space ready. This is not the same for inside your house. You are still only allowed 5 more people from outside your household to a maximum of 10 in total. And keep your friendship circle small. Up to 50 people can now get together outside as long as they stay 2 meters apart. That will open up the chance for your community to hold small outdoor events this summer. Our parks are now opening with new rules to keep you safe. We can go overnight camping and enjoy what our great North has to offer. Children's summer camps, both indoor and outdoor, and education facilities can open up with a few measures in place. Government offices are working to open safely. Opening safely may take some time. Restaurants, movie theaters, and many other businesses can open up with public health measures to safely serve the public. Outdoor funerals can double in size, and we have updated guidelines on our website for hosting them safely. If you worship, your faith community can now gather inside. The maximum is 25, but if your location is small, you need to adjust accordingly. We recommend that faith-based organizations keep virtual services running to provide for their most vulnerable members. Most indoor and outdoor sports will be allowed with a few exceptions. Sports may need to comply with National Association guidelines to get liability insurance coverage before running a league, so it is important to check. N.W.T has very strong occupational safety legislation. Every business, organization, and facility must complete a WSCC exposure control plan, and risk assessments to protect the public and workers while we start to open up. With the COVID pandemic progressing globally, phase 2 means we would need you to take precautions seriously now more than ever. Reopening society means we are taking on more risk. And without keeping on our toes, we could be in for a nasty surprise. Canada must prepare for a second wave of COVID infections this fall. Canada's Chief Public Health Officer, Dr. N.W.T, worries that opening too quickly or without care will cause an explosive second wave. We are merging wisely in phases to control risk and monitor. A second wave of COVID will threaten our territory and could overwhelm our health system and small communities. There's too much at stake to allow this pandemic to sweep across our territory as it has in so many other places. And our best defense is each other. I will recommend again, get used to wearing a non-medical mask when you're out. Everybody wearing a non-medical mask when they're out will slow the spread of the virus. Wash your hands and do it a lot. We have ample hand sanitizer, so keep some on you at all times. Keep your germs to yourself by coughing into a tissue or flexed elbow. And if you're sick at all, stay home and call your health center to see if you should be tested. Keep your physical distance. 2 meters is bigger than you think. Think the length of a snowmobile. And remember, we can get through this together, but only if we stay apart. Thank you.
Thank you, Dr. Kandola. So we're going to open up the line to questions from media. There are a number of you on the line this afternoon, so please keep your questions to 1 question and 1 follow-up, or 2 questions if you do not have a follow-up. We're going to get started with Mariah from CKLB. Mariah, is your mic maybe muted?
Hello, sorry, thank you.
Yeah, no problem, go ahead.
My question is in regards to hospital visitations. When and how will we see an ease on restrictions in regards to that?
Thank you, Mariah. For hospital visitations, you have to be directed to the policies of the authorities of the Northwest Territories Health and Social Service Authorities on their hospitals, and they would provide the timeline of when they'll be easing up on the visitor restrictions, but they do have them in place. But I direct you to request that information from the hospital that you want to visit directly.
So just to confirm, it's by an individual basis for the hospital?
The NTHSA, the 4 hospitals where you're looking at Hay River, Inuvik, Fort Smith, and Stanton, they're all working together. They have consistent messaging around their response to the COVID-19 outbreak. But if you are looking to visit a loved one in a hospital, it'd be simpler to contact that hospital directly.
Thank you very much.
Thanks, Mariah. Let's turn Alex, CBC.
Hi, all. Thank you for this. Premier, I understand that on May 29th, there were those practical changes to the travel restrictions. Why did it take 2 weeks to notify the public of that change?
Thank you. On May 29th, my understanding is that there was a change, not to the order, an interim measure because of the charter challenge that was happening. Communication is something we've had to make huge policy decisions in a matter of hours sometimes since COVID-19 hit. Do take some responsibility for this. We were in session going from 7:30 till often 9, 10 at night. We were, as cabinet, we were informed actually on the Sunday, the June 7th, and on Monday, June 8th, that we discussed it in cabinet as a whole. The reality, like I said, there was many extenuating situations that was happening with that. But the commitment is, we recognize we've made mistakes. We have not said that we have done this perfectly. The minister has said that. We've made decisions based off what we had available. Some decisions had to be made very quickly. And so we operate with the information we had. We have a commitment. We've talked about it. We realize that communication, we need to be clearer in our messaging, and we need to be more timely. And we do owe the public as much information as possible. This affects every one of us. So on that, again, thank you.
Follow-up, Alex?
Thank you for that, Premier. So, I understand the gravity and the speed, but this is the third instance of something like this happening where policy change is being made and the public's not hearing about it till after the fact. What concrete steps are you implementing as a Premier to make sure that this doesn't happen again?
Yes, so what we've discussed with the Chief Public Health Office and our Minister of Health and Social Services is that it doesn't matter if cabinet is meeting or if session is on or not. It does not matter if we are working 15 hours a day. We have a responsibility to you as our public. So we've discussed it and we've made a commitment that we will meet on a regular basis from now on, no matter what is happening, and we will do our best to inform so that all of us are informed on any changes that come up, and we do our best to inform the public. Again, I take ownership and I do apologize for the lack of communication that was shared with the public.
Thanks for those, Alex. We're going to turn now to Matisse at Radio Canada.
Yeah, hi. My question is regarding the exceptional circumstances approvals. Can you please clarify in which specific cases you'll be able to grant those to non-resident family members?
So, thank you, Matisse. We have prepared a one-pager to outline our compassionate exemption protocol. So, typically, it's a scenario where a loved one is sick in N.W.T. and the request is for a family member to come visit. That's a scenario. Or someone is seeking childcare, or someone simply, when you look at family reunification, they simply want to visit a family member or an intimate partner. These are the exemptions that we will be reviewing and granting from my office. There are other scenarios where people are planning to move here or planning to purchase property and need to come ahead of time to review the sale, or they have items that need to be retrieved. Each of these compassionate exemptions can be varied, but I do want to reassure N.W.T. residents that if they do have a loved one or if they have relatives who need to visit them for various reasons, that to call Protect N.W.T., explain their case, and that compassionate or exemption would be sent to my office for review and for approval.
A follow-up there, Matisse? I think you might be muted, Matisse. All right, we'll come back and check there later. Let's move now. Paul Bickford, Hay River Hub, I see you're on the line.
Yes, thank you. This is a question for Mr. Baetz. Mr. Baetz, have you been contacted by the town of Hay River about their concerns and general concerns in the community about people in self-isolation here in the community and how they're being monitored? And if you have been contacted, what sort of concerns have you been informed about?
Thank you for the question. I have had dialogue with the town of Hay River on several occasions on a number of fronts, and including the self-isolation protocols and people that might not be following them. And we do our very best with every complaint that we do get through Protect N.W.T. To follow up on each of the protocols or each of the reports that we do get of people not following self-isolation protocols. Thank you.
Follow-up,
So
Paul?
I guess the follow-up to that would be, do you think that the procedures that are now in place for monitoring are sufficient, or considering the number of concerns in the community, are you looking at changing these policies?
I believe that one of the things that we need to make sure that we do is we need to be open to hearing what the complaints and the concerns are, and where we need to improve some of our reactions or some of our approaches to what those complaints are, that we take the steps to improve them. It's really important to make sure that as we go through this whole pandemic exercise, that we're evolving as we go, and we're getting better with each and every day and each and every week at responding to complaints, and at making sure that everything is looked into in a very timely and a very efficient and effective way.
Thank you.
Thanks, Paul. Ollie, Cabin Radio.
Thank you very much, Crystal. This is probably another question for Conrad. It's along similar lines. Conrad, I think people are starting to understand this in terms of how it works. Non-exempt, non-residents turn up at the border. You can't physically keep them out, but they come in, they have to go to an isolation center. How will you ensure non-exempt travelers actually go to isolation centers when you tell them to?
Non-exempt travelers, I guess first off, non-exempt travelers need to have the proper paperwork, or they don't travel within the N.W.T. As a part of the paperwork is where they are going and which isolation center they're going, or whether they're isolating in some other place in one of the 4 hubs. So the documentation that we take at the border, when they do have the proper documentation, are what we rely on to ensure that proper follow-up occurs.
Okay, not to contradict you there, Conrad, but the N.W.T has already said that if non-exempt travelers turn up at the border, they might be voluntarily asked to turn around, but if they still insist on coming in, the N.W.T has just said it can't stop them, but it will tell them they have to go to an isolation center and then seek an exemption from there. So how will you ensure that those people actually do that and that they stay in isolation once they're there?
For people that don't have the proper paperwork, if they're not one of the individual categories that are exempt, i.e. a resident, an essential worker, a new resident coming in, a new worker coming in, they will be asked to voluntarily turn around. If they choose not to, then that's what was referred to earlier in both Minister's remarks as well as Dr. Kandola's remarks, that they will be ticketed. If you find yourself at an airport where you cannot turn around and travel back in that same day on an aircraft, then there will be an opportunity for an exemption until the individual can catch the next flight returning to their point of origin. And that would be the exemption, and it would be at an isolation center that they would be required to stay at.
Mm-hmm. Does that answer your question, Ollie?
Not particularly. I mean, it's pretty much contrary to what we've been told over the last few days, and even in the news release just now, backgrounder about what would happen if someone insists on coming in. We've been told that they would be allowed to apply for an exemption, but they'd have to wait in an isolation center while they did it. If then they were denied an exemption, then they would be subject to that process of ticketing that we just heard about from Conrad there. I think more broadly, Conrad, if I can have one more, Crystal, I'll owe you a beer later. Tell me, in general terms, in terms of people getting to isolation centers, people are worried about this. How are you monitoring that? How are you proactively ensuring that people do go and isolate in isolation centers when you've told them to?
So certainly, as people are crossing the border that identify themselves as going to an isolation center, that information is sent on a daily basis to the isolation centers to ensure that there is a reconciliation done between who's come into the N.W.T. and whether or not they've attended or shown up at the isolation center. If they do not show up, then there are obviously calls to the compliance and enforcement team, whereby we would follow up and track individuals down. And we have, in fact, done that over the last couple of months on occasion. Most people do follow the instructions at the border, and most people do, when they say they're going to attend to an isolation center, in fact, do that.
I'm going to move now to Thomas, Radio Taiga, sorry.
Yes, thank you. So here we're curious to know, actually, why did it take so long from the moment borders were closed to non-residents to the moment you realized the restrictions were non-conform to the Canadian chart, and maybe what made you realize that this was not conform?
We'll let Dr. Kandola take that one.
So on March 21st, we put our initial order in place, and we always work with legal advice when we put our orders in place. April 27th, we had an amendment to that travel restriction order, which we announced. And between April 27th to June 12th, this is when the new amendment has been put in place. So we have a new order in place. There was charter challenges in other parts of Canada, and so we, from our legal advice, we reflected that amendment in today's current order. So in today's current order, which is effective as of June 12th at noon, we, anyone who wants to move to the territories or are looking for work, we are not impairing the mobility. We've amended the travel restriction self-isolation protocol where they would be allowed to do those very functions. For those who don't fall into the this amendment or the exceptions, we are, as of noon today, we can't prevent them from coming over the border, but if they are within the territories, we can, they fall under our travel restrictions. So if they don't fall within this amendment, they're asked to voluntarily turn around, and if they continue to proceed, then we can ticket them.
Premier Cochrane, did you want to touch on that as well, or?
I think that the Chief Public Health Officer covered it very well. Again, like I said, COVID-19 hit us all very quickly. We had to make very fast decisions. Sometimes fast decisions aren't the best decisions, but we made the best decisions with the knowledge that we had at the time. So as we found out new knowledge, then we have to amend the decisions that we make, and that's the reality of what we face.
Thank you. Follow-up question on that?
Yes, maybe. Would you have details on how you found the new knowledge? Maybe at April 27th. What happened? Yeah, to make you change your mind, actually.
We're continually working with Department of Justice. We're reviewing, we're implementing orders. We're always reviewing with new information. So there was a new information where there was a charter challenge in another province. So that allowed legal and us to re-review our order and say, how does our order compare? And therefore, we have made amendments, and those amendments are in force as of today.
All right, thank you. I understand Blair, Northern News Service's mic is not working, so I have some typed out questions here I'll ask on your behalf, Blair. The first question, when can liquor stores resume regular hours, and when will the $200 restriction be lifted? Can we touch on that?
That information I'll have to deflect to the Minister of Finance. It's not under my domain.
Okay, so Blair will get that information for you, and I'm going to go ahead and guess that the second question we won't have an answer to either, which is just, what are people supposed to do if they're having a large wedding party and want to purchase large amounts of alcohol? So I presume we'll get that information from the Minister of Finance as well. Okay. So Blair, if you think of a different question that we can answer in the meantime, feel free to shoot that via text, and we'll ask it for you just to make it fair. I'm going to loop back around. We've got two reporters on the line from CBC. So I understand Danielle's on the line, but Alex is going to ask another question on her behalf. So Alex, go ahead.
Yeah, thank you, Crystal. This question may be for Dr. Kandola. And again, just in terms of when you're making your exemptions, I'd like to know, does tourism qualify? Is that something that you would consider making an exemption for?
Thank you, Alex. In the current amendment for Friday, June 12th, that's in effect at noon, that's available on the website. In that amendment, leisure travel does not qualify for an exemption.
Thank you very much for that clear answer. And in the follow-up, beyond family leave, or grounds for compassionate and the essential workers, are there any other extenuating circumstances you would consider that you can tell about for people kind of in that gray area, not sure if their exemption qualifies?
So what I will do is, first I'll list the categories of those who are exempt, and then we can go. So currently, N.W.T residents, both new and old residents, are exempt. Essential workers and those supporting them with child and dependent care exempt. Infrastructure workers, those coming into N.W.T to work, including those doing short-term contracts, those coming to attend post-secondary school, those moving to the N.W.T, supply chain workers, like long-haul truck drivers, remote camp workers, traditional harvesters, and then the category that we're talking about specifically are those who receive an exemption due to exceptional circumstances after applying to the Chief Public Health Officer. Because I have to approve all these exemptions, typically the categories have been family members who are required to come here for a funeral, or they have a very sick relative, or they're providing childcare. There's been other scenarios where someone who's not an essential worker but needs childcare. There are other scenarios where people are coming in to retrieve belongings and to move out of the territories. Each of these circumstances are unusual, but pretty much that covers 95% of it. The 5% that could be other, I have a willing ear. I'm always there to listen to the reason and the story, and then I make a decision. But by and large, 95% are the scenarios that I've mentioned, and 5%, we can't cover everything. So let me hear your story.
Oh, I don't know. I'm just. I just think that just for people who are wondering, it really seems to me the leisure travel is the thing that's definitely not allowed.
So if I may, Dr. Kandola, correct me if I'm wrong, but I think what we're hearing you say is that, if you think you don't apply for an exemption, fill out an exemption form well before you come to the territory. She'll look at the exemption form. If you are exempt, great, and if you're not, she'll let you know. Does that sound about right?
Yeah, and the definite one is at this point, leisure travel. It's non-essential travel. We're restricting that, and so that would not apply. That would not receive an exemption.
Great. Thank you very much.
Thanks, Alex. Mo Musafem, are you on the line? Maybe another muted mic, perhaps? No? Okay, so we'll give you a few minutes to see if that gets turned on. We have a question online that I'd like to ask. Can someone speak to when restaurants will be permitted to open? Dr. Kandola.
So restaurants, as of noon today, can have a maximum of 25 clients, depending on their spacing. If they can accommodate up to 25, they're allowed to open, but they need to have physical distance and have public health measures in place. Prior to this, restaurants can only provide takeout, but they're now allowed to open indoors. And if people in restaurants feel that they have larger space, they can accommodate more than 25 safely, we are also open to listening to their costs and to their floor plan and reviewing that as well. So go ahead and eat indoors in restaurants if there's space available.
Great, thank you. We got another question here online that I'll go to. This one's from Blair. Hopefully you have an answer for him. He says, the release says that travelers arriving in the N.W.T. who do not want to turn around must seek an exemptional circumstance exemption and self-isolate immediately. But according to the backgrounder that we've issued, we've also said individuals entering the territory who do not meet the criteria outlined in one of the exemptions are not allowed to travel within the N.W.T, and it's an offense to proceed. Can we confirm for him, if they proceed to self-isolate for 14 days first, will they then be permitted to travel within? If they pay for their self-isolation himself, he's also cited.
So what I want to clarify is there's an order, a new order, it's amended order. It's the amended travel restriction self-isolation protocol. It's in effect now. So what people heard or read yesterday or before noon, as of today, we have a very strong and clear travel restriction and self-isolation protocol. And so if you don't meet those exemptions, you can, the moment you cross over the N.W.T border, that travel restriction self-isolation protocol will apply to you. So if you don't have the proper paperwork and you don't meet the exemption, we could ask you right then and there to turn around voluntarily. But if you continue going, then we can ticket you. And that applies in the airport, is we will ask you to turn around voluntarily. And if you can't, because you can no longer book a flight that day, then they would seek an exception where you can self-isolate to the next available flight, not 14 days. So to avoid confusion, it's really, really important that people only look at the order that's effective as of noon today, because when I'm listening to journalists talk, it seems there's been, they're still referring to information that's now outdated and is no longer relevant and no longer current.
All right, we're going to see if Mo from Moose FM is on the line or got his mic working. Are you there, Mo? No, okay. And Matisse, Radio Canada, are you still on the line? You only had one question. I wanted to give you an opportunity for a second there. No? Okay. Well, then you know what? We're going to leave it there. That's good timing for us. So thank you to everyone for your thoughtful questions. Appreciated. Lots of good questions online. Of course, all this information will be posted online, and to all the reporters, you will have seen the contact information from media on the news release that was issued today. I urge everyone to go and read that information, share it with your friends, talk about it, and you know, like I said, email us if you've got any further questions or clarifications that are required.